Good day, everyone. We are the proponents of Group 2 and we are going to present a case study about hysterectomy. Chapter 1. The problem and its setting. General objective. This study aims to provide deeper theoretical and practical knowledge and information about hysterectomy. Additionally, to enhance student nurses' skills and capabilities in rendering effective nursing care to their clients with the same condition to promote health maintenance, health restoration, alleviate suffering, and provide comfort. The term hysterectomy originates from two Greek words, hystero, which means uterus, and ectomy, which means resection removal from the human body. A hysterectomy is the surgical removal of the uterus. It ends menstruation and the ability to become pregnant. Reasons for this surgery include abnormal bleeding, uterine prolapse, and cancer. Depending on the reason for the surgery, a hysterectomy may also involve the removal of other organs and tissues such as the ovaries and/or fallopian tubes. Moreover, this surgical procedure is indicated in several common gynecologic problems and is the only way to treat problems affecting the uterus. For certain conditions, however, hysterectomy may be the best choice. For the patient's data, name Client B, address Cabanatuan City, date of birth July 22, 1990, age 31, gender female, civil status married, height 5'4", weight 52 kilograms, nationality Filipino, religion Roman Catholic, occupation housewife. For the family history, in general, Client B's family health history denotes that some of the members have shown motion sickness. History of past illness, the client had a history of motion sickness. For the admitting history, a 31-year-old woman is admitted to the Phase 1 PACU after undergoing an abdominal hysterectomy. On this day, however, she became quite anxious concerning the surgery. Upon awakening, Client B is quite agitated. She is moving from side to side and is not yet oriented to place and time. When questioned, Client B states that her pain is 7 on a scale of 10. The nurse administers 2 milligrams of hydromorphone IV per order. The narcotic appears to begin to take effect, and when questioned, patient B's pain is now reported as a score of 4. However, she is complaining of nausea and asking for an emesis basin as she is afraid she will vomit. The nurse asks her to take slow, deep breaths through her mouth and encourages her to relax. For the status of present illness, Client B has motion sickness but it wasn't triggered and remained stable throughout the whole session of operation. The physical examination are the chest, which has irregular respiratory rate of 26 cycles per minute, genital area which has abnormal vaginal discharge.
For the anatomy and physiology of the hysterectomy, book base. First is vagina. It is a hollow membranous and muscular canal, 3 to 4 inches long, dilatable, contain rugae. It is located in front of the rectum and behind the bladder. The vagina is the female reproductive tract and has 2 primary functions: sexual intercourse and childbirth. Second is uterus. The uterus or womb is a major female hormone responsive reproductive sex organ of most mammals, including humans. One end, the cervix often into the vagina, while the other is connected to the one or within the uterus that the fetus develops during gestation, usually developing completely in placental mammals such as human. Fallopian tube. The fallopian tube, also known as oviducts or uterine tubes, salpinx, and singular salpinx, are 2 very fine tubes lined with ciliated epithelia leading from the ovaries of female mammals into the uterus via the uterotubal junction. And the cervix. The uterus is the primary female reproductive organ. It is situated within the pelvis and measures approximately 8 cm in length, 4 cm in width, and 5 cm in depth in the normal and non-pregnant state. For the endometrium, this is the innermost layer of the uterus. The thickness of the endometrium is regulated by hormones and so varies according to the pace of the menstrual cycle. Another name for this lining layer is the mucosa. Myometrium. The middle layer is a thick wall made of smooth muscle cell. And the ovary are small oval-shaped glands about the size of an almond that are located on either side of the uterus. The ovaries produce eggs and hormones. And serosa, the outermost layer consists of a membrane called the serosa. This is a thin layer merged with connective tissue ligaments that suspends the uterus in the pelvis. For the anatomy and physiology of the reproductive system, client base, hysterectomy involves removing the uterus and the cervix. This condition might lead to early menopause. The condition might be caused by having a heavy period, which can be caused by fibroids, pelvic pain, which may be caused by endometriosis, unsuccessful treated pelvic inflammatory disease or PID, adenomasis or fibroids prolapse of the uterus. For the pathophysiology of hysterectomy, for the modifiable, it includes lifestyle, alcohol drinking, and smoking. And for the non-modifiable, age, gender, genetic, and predisposition that lead to uterine fibroids that cause pain, bleeding, or other, and a sliding of the uterus from its normal position into the vaginal, down to cancer of the uterus, cervix, or ovaries that lead to abnormal vaginal bleeding that cause chronic pelvic pain and lead to adenomasis or a thickening of the uterus. For the signs and symptoms, it includes fever or chills, heavy bleeding, or unusual vaginal discharge, severe pain, redness or discharge from incisions, problems urinating or having a bowel movement, and shortness of breath or chest pain. For the clinical manifestation, signs, and symptoms, for most women, life without a uterus means relief from the symptoms that cause them to have hysterectomy bleeding, pelvic pain, and abdominal bloating. With relief from those symptoms, women may have better sex with greater libido, frequency, and enjoyment. Yet, if the ovaries were removed, there are few more challenges ahead. If you had not gone through menopause before your hysterectomy, you will probably begin having symptoms of menopause, hot flashes, and mood swing. Your body is adjusting to changes in hormone levels. You may also have some changes in sexual desire and enjoyment, and vaginal dryness. Most women begin hormone replacement therapy before they leave the hospital because bodily changes can be so drastic. For the treatment and management of hysterectomy, if your ovaries were removed with the uterus, you may want to consider hormone replacement therapy or HRT to ease some symptoms. Your age and medical history are factors to consider when deciding on HRT. Talk it over with your doctor. There are non-hormonal treatments that can help. Effexor and other SSRI antidepressant, clonidine, a blood pressure medication, and Neurontin prescribed for seizures and chronic pain have been found to be effective in treating hot flashes. Also, some women experience pain during intercourse after a hysterectomy. For the medical management, for operative management, the physical preparation of a patient undergoing hysterectomy differs later from the patient undergoing laparotomy. The lower half of the abdomen and the pubic and perineal regions may be shaved, and these areas are cleaned with soap and water. Also, some surgeons do not require that the patient be shaved. The intestinal tract and the bladder need to be empty before the patient is taken to the operating room to prevent contamination and injury to the bladder or intestinal tract. An enema and antiseptic douche may be prescribed the evening before surgery, and the patient may be instructed to administer this treatment at home. Preoperative medication administered before surgery may help the patient relax. For the post-operative management, the principle of post-operative care for abdominal surgery applies with particular attention given to peripheral circulation to prevent thrombophlebitis and deep vein thrombosis, noting varicosities, promoting circulation with leg exercises, and using elastic compression stockings. And also major risks are infection and hemorrhage. In addition, because the surgical site is close to the bladder, voiding problems may occur, particularly after a vaginal hysterectomy. For the nursing management, first is assess the patient's wound for any virulent drainage or abnormal redness. Second, provide time to listen to concern and fears of patient. Discuss patient perception of self related to anticipated changes in her specific lifestyle. Third is assess the emotional stress the patient is experiencing. Identify the meaning of loss for patient and encourage patient to vent feelings appropriately, and provide accurate information, reinforcing information previously given. Uncertain individual strength and identify previous positive coping behaviors. Also provide an open environment for the patient to discuss concern about sexuality, and educate and demonstrate to the patient how to properly change her when dressing, usually using clean techniques starting on post-operative day 2, and provide the patient with local support group she can attend to help with grieving.
Chapter 3, Laboratory Results. Laboratory tests can help determine a diagnosis, plan treatment, check to see if treatment is working, or monitor the disease over time. First, we have the CBC test. A CBC can help diagnose a broad range of conditions, from anemia and infection to cancer. The three basic types of blood cells measuring changes in your blood cell levels can help your doctor evaluate your overall health and detect disorders. The test measures the three basic types of blood cells. These are hemoglobin, RBC, WBC count, platelet count, and hematocrit. The table shows that the client CBC tests, the WBC count, hematocrit, platelet count are in normal range. However, hemoglobin, RBC count are not in normal range due to the blood loss or blood transfusion.
For the first nursing care plan assessment, subjective, the patient verbalized, "Masakit dito banda," with the arm pointing at surgical incision. Reported pain with a pain scale of 7/10. Objective, conscious and coherent. Weak in appearance, with intact and dry dressing over the incision site. Facial remains. Vital signs taken as follows: temperature of 37.3 degrees Celsius, respiratory rate of 26 counts per minute, pulse rate of 45 beats per minute, and blood pressure of 90/60 millimeters of mercury. For the nursing diagnosis, pain secondary to surgical operation, hysterectomy, as evidenced by reported pain with a pain scale of 7, pain scale from 1 to 10, and limited range of motion. For the outcome identification, short term, within the 8 hours of shift, the patient's pain will be relieved and controlled. Long term, the patient will perform activities of daily living independently after 6 to 8 weeks. For planning, short term, after 8 hours of rendering nursing interventions, the patient will be able to decrease pain scale of 7 to 10 to 4 to 10 as evidenced by stable vital signs. Long term, after 6 to 8 weeks of nursing interventions, the patient's pain will diminish and will be able to do activities of daily living independently. For the independent nursing interventions, monitor vital signs. These will be used as a baseline data, and changes in vital signs may be used for a rough estimate of pain. Evaluate pain regularly, noting characteristic of pain, noting verbal reports, nonverbal cues, for example, moaning, crying, restlessness, diaphoresis, clutching chest, and rapid breathing, and hemodynamic response such as BP or heart rate changes. Variation of appearance and behavior of patients in pain may present a challenge in assessment. Most patients with pain appear ill, distracted, and focused on pain. Verbal history and deeper investigation of precipitating factors should be postponed until pain is relieved. Respirations may be increased as a result of pain and associated anxiety. Release of stress-induced catecholamines increases heart rate and BP. Obtain full description of pain from patient including location, intensity, duration, characteristic, and radiation. Assist patient to quantify pain by comparing it to other experiences. Pain is a subjective experience and must be described by patient. Provides baseline for comparison to aid in determining the effectiveness of therapy, resolution, or progression of the problem. Instruct patient to report pain immediately. Delay in reporting pain hinders pain relief or may require increase in dosage of medication to achieve relief. In addition, severe pain may induce shock by stimulating the sympathetic nervous system, thereby creating further damage and interfering with diagnostic and relief of pain. Provide safety measures. This is to prevent injury. Provide comfort measures like helping the patient assume position of comfort. Suggest use of relaxation technique and deep breathing exercises. Promoting relaxation enhances coping abilities. Keep a chest in semi-Fowler's position. Gravity localized inflammatory exudates in lower abdomen or pelvis, relieving abdominal tension which is accentuated by supine position. Encourage diversional activities like watching TV or reading books. Refocuses attention, promotes relaxation, and may enhance coping abilities. For the dependent nursing intervention, administer analgesic as indicated to maximal dosage as needed. This is to maintain acceptable level of pain. For collaborative nursing interventions, evaluated laboratory results. This is to check for any imbalances. For the evaluation, short term, after 8 hours of rendering nursing care, the goal was met as evidenced by decreased pain scale to the level of 4/10. For long term, after 6 to 8 weeks of nursing intervention, the goal was met as the patient was able to move and do activities of daily living independently. Nursing care plan, assessment, subjective. Hindi ako mapakali-iisip sa operasyon as verbalized by the client. Objective, blood loss. Vital signs taken as follows. Temperature of 37.3 degrees Celsius, respiratory rate of 26 counts per minute, pulse rate of 45 beats per minute, and blood pressure of 90/60 millimeters of mercury. For the nursing diagnosis, risk for ineffective tissue perfusion as evidenced by blood loss. For the outcome identification, after 8 hours of nursing interventions, the client will demonstrate adequate perfusion as evidenced by stable vital signs, palpable pulses, good capillary refill, usual mentation, individually adequate urinary output. For planning, short term, after 8 hours of nursing interventions, the client will demonstrate adequate perfusion as evidenced by stable vital signs, palpable pulses, good capillary refill, usual mentation, individually adequate urinary output. For the long-term planning, after 1 week of nursing interventions, the client will have a good condition and free from edema, signs of thrombus, and vital signs will be maintained within normal limits. For the independent nursing interventions, monitor vital signs, palpate peripheral pulses, and note capillary refill, assess urinary output and characteristics, evaluate changes in mentation. These indicators of the adequacy of systemic perfusion, fluid or blood needs, and developing complications. Inspect dressings and perineal pads, noting color, amount, and odor of drainage. Weigh pads and compare with the dry weight if the patient is bleeding heavily. Proximity of large blood vessels to the operative site and or potential for alteration of clotting mechanisms increases the risk for postoperative hemorrhage. Turn the patients and encourage frequent coughing and deep breathing exercises. It prevents the cease of secretions and respiratory complications. Avoid high Fowler's position and pressure under the knees or crossing of legs. It creates vascular stasis by increasing pelvic congestion and pulling of blood in the extremities, potentiating the risk of thrombus formation. Assist and instruct in foot and leg exercises and ambulate as soon as able. Movement enhances circulation and prevents disease complication. For the dependent nursing intervention, administer IV fluids, blood products as indicated. Replacement of blood losses, maintain circulating volume and tissue perfusion. For the evaluation, after 8 hours of nursing interventions, the client demonstrates adequate perfusion as evidenced by stable vital signs, palpable pulses, good capillary refill, usual mentation, individually adequate urinary output, and lastly, the goal was met. For the third nursing care plan, assessment, subjective. Nahihilo ako at nasusuka as verbalized by the client. Objective, vital signs taken as follows: temperature of 37.3 degrees Celsius, respiratory rate of 26 counts per minute, pulse rate of 45 beats per minute, and blood pressure of 90/60 millimeters of mercury. For the nursing diagnosis, risk for aspiration as evidenced by nausea and vomiting. For the outcome identification, after 8 hours of nursing interventions, the client's risk for aspiration will decrease as a result of ongoing assessment and early interventions. The vital signs will be maintained within normal limits. For planning, short term, after 8 hours of nursing interventions, the client's risk for aspiration will decrease as a result of ongoing assessment and early interventions. The vital signs will be maintained within normal limits. For the independent nursing interventions, keep suction machine available when feeding high-risk patients. If aspiration does occur, suction immediately. A patient with aspiration needs immediate suctioning and will need further life-saving interventions such as intubation. Supervise or aid the patient with oral intake. Supervision helps identify abnormalities early and allows implementation of strategies for safe swallowing. Withholding fluids and foods as needed prevents aspiration. Allow the patient to chew thoroughly and eat slowly during meals. While masticated food is easier to swallow, food cut into small pieces may also be easier to swallow. Note new onset of abdominal distension or increased rigidity of abdomen. Abdominal distension or rigidity can be associated with paralytic or mechanical obstruction and an increased likelihood of vomiting and aspiration. For patients with reduced cognitive abilities, eliminate distracting stimuli during mealtimes. Tell the patient not to talk while eating. Concentration must be focused on chewing and swallowing. There is a higher risk for the airway to be open when talking and eating at the same time. Offer liquids after food is eaten. Ingesting food and fluids together increases swallowing difficulties. For the dependent nursing interventions, place whole or crushed pills in soft foods. Verify with the pharmacist which pills should not be crushed. Mixing pills with food helps reduce risk for aspiration. Perform suctioning as ordered by the physician. This is to clear secretions and provide patent airway. For the evaluation, after 8 hours of nursing interventions, the client's risk for aspiration decreased as a result of ongoing assessment and early interventions. The vital signs were maintained within normal limits, and lastly, the goal was met. For the fourth nursing care plan, assessment, subjective, the client verbalized problems such as loss of sexual desire, inability to achieve desired satisfaction, objective, change of interest in self and others. For the nursing diagnosis, sexual dysfunction related to altered body structure and function. For outcome identification, within 8 hours of shift, the client will be able to discuss concerns about sexual functioning. For planning, short term, after 8 hours of nursing intervention, the client will identify stressors in lifestyle that may contribute to the dysfunction. For the long-term planning, after 3 days of nursing interventions, the client will verbalize understanding of reasons for sexual problems. For the independent nursing interventions, establish rapport. This is to gain trust. Establish therapeutic nurse-client relationship. This is to promote treatment and facilitate sharing of sensitive information. Provide factual information about the client's condition and its implication to her sexuality. By doing so, the client is made aware that although she does not have the capability to conceive, it does not mean that she cannot have relationships. Be alert to comments of client. Sexual concerns are often disguised as humor, sarcasm, and offhand remarks. Identify current stressors in individual situation. These factors may be producing enough anxiety to cause depression. Avoid making value judgments. They do not help the client. Actively listen to client's expression. Active listening supports the client without intrusive advice giving. For collaborative nursing intervention, refer the client to sexual therapists, referring to other healthcare team for co-management. For the evaluation, short term, after 8 hours of nursing intervention, the client identified stressors in lifestyle that contribute to the dysfunction. Goal was met. For the long term, after 3 days of rendering nursing interventions, the patient verbalized understanding of reasons for sexual problems. Goal was met.
Chapter 5 Drug Study.
Ondansetron. Ondansetron is a 5-HT3 receptor antagonist used for moderately to highly emetogenic cancer chemotherapy, radiotherapy, and postoperative. Hydromorphone. Hydromorphone are narcotic analgesics used for moderate to severe acute pain and severe chronic pain. Scopolamine patch. Scopolamine patches are antiemetic drugs used for prevention of nausea and vomiting associated with motion sickness and post-operative nausea and vomiting associated with recovery from anesthesia and/or opiate analgesia and surgery.
Chapter 6 Summary of Findings, Conclusion, and Recommendations. The summary of findings. The underlying problems of the client have been identified from the data gathered. And the first one is to respect the client's privacy. The client's name has been hidden and she lives in Cabratuan City. Number 2, upon interview, the client had undergo an abdominal hysterectomy. 3, also, the client is a non-smoker and had a history of motion sickness. And 4, the student nurses performed interventions to promote client's health status. Conclusions. From the data gathered in the findings, the conclusions are as follows. Number 1, the client's risk for other complications have been lessened from the interventions performed by student nurses. And number 2, the client acquired such complications from past history. Further recommendations. In order for the client to lessen the risks from occurring again, the following recommendations would include but not limited to: Number 1, take medications accordingly as prescribed by the physician. Number 2, seek medical attention to determine if any underlying complications would arise. And number 3, have teaching for the client as the client needs to be educated about risks and other complications.